Hi, I'm Sarah. I'm a student nurse at St. Martin's University. I have my patient Scott Mingus here, and he needs to get a IV catheter inserted. I have pulled up the MAR, and he has a order put in for morphine. He has no known allergies, and he has no allergies to tape or any of the products that I'm going to be using today. I have the right medication, which is morphine, the right patient, which is Scott. I have the right dose, which I have 10 milligrams per milliliter vial here, and the doctor has ordered 3 milligrams, so I'm going to be administering 0.3 milligrams, and he will be receiving 0.1 milligrams per minute. And the route is going to be an IV access, and it's the right time. And the right reason is because he has like 7 out of 10 pain. Also, I have viewed the side effects of medication, and this is within the safe dose range for him. I'm gonna go ahead inside his room and introduce myself. All right, knock, knock. Hi, Scott. I'm Sarah. I'm your nurse today. Hand hygiene, privacy. I'm going to be doing your IV site and administering your pain meds today. I'm going to go ahead and check your badge, name and date of birth, please. Awesome, that's you. Any questions? Have you had an IV site put in before? No? Are you familiar with the medication morphine? Well, this is gonna help your pain pretty quickly, and there are some side effects like nausea, vomiting, dizziness, but it should help with the pain big time, and he will be here to help you. You have your call light and all that fun stuff. You still agree to this treatment? Yeah? All right, cool. So let's go ahead and get started. I'm gonna go ahead and ask you to go ahead and go like this and get the blood flow going. I'm gonna be inserting a catheter in you. It shouldn't hurt that much. This is the arm you want, all right, because you gave it to me. It shouldn't hurt that much. Just a little pinch. All right, check for radial pulse. There it is. That looks like a good vein right there. All right, go ahead and clean you up. About 30 seconds. Okay, let that dry. I'm gonna go ahead and prep this. All right, we're gonna prep this line. Bubbles out. Go. Oh. No, okay. Any questions for me? You agree to the procedure? Like I said, I told you the symptoms that you probably will be experiencing. Go ahead. Go ahead and go like that again. All right. All right. I have my bandage here, and I have my date, then my initials, the type of catheter used, and the time. All right. Okay, assess your radial pulse again. Okay. pull down. There's the blood return, enhance a little bit more. There's that. I'm gonna look for blood return. Pretty good. All right, I'm gonna go ahead and I'm gonna flush for about a minute. All right, I have my, my label here. I'm gonna go ahead and, oops, I forgot to do that. Take that off. This will be disposed in the sharps container. Put that over. All right, that was pretty easy. Okay, so there should be no pain with that, no pulling on or anything like that, but if you have pain, let us know. There's no blood on my gloves, but if there was, I would change it. All right, so I aspirated and, okay, that's good. Now I'm gonna prepare my medication. I'm gonna do my second check. Okay, I have my patient, the right patient, Scott Mingus, the right medication, morphine, at the right time, the right route, the right reason, the right dose, which was 0.3 milliliters, and the right time now, okay? Clean this off, 15 seconds. Okay, so we're gonna be doing 0.3, the morphine. Checked ear. Okay. I'm gonna check for blood return again. Okay, got it. That for a minute. I'm gonna go ahead and take that off, and then I'm gonna clean that off for about 15 seconds. Okay. This goes in the sharps container. All right, before giving the medication, I'm gonna do my last checks. I have the right patient, Scott Mingus. I have the right dose, which is 0.3 milliliters of morphine, which I'm gonna be administering at 0.1 milliliters per minute. The right route at IV site, the right time, which is now, and the right reason, because he's in pain, which he states is like 7 out of 10. So I'm gonna go ahead and gonna administer the medication. I don't remember if I cleaned that, but I'm gonna go ahead and clean this again just for fun. Don't remember. Okay, I'm gonna go ahead and put it in, and I'm gonna go ahead and administer this over 3 minutes. and I'm gonna go ahead and I'm gonna provide teaching to the patient, you know, make sure that he's tolerating the medication appropriately and assessing the site. And I would also let him know that he has his call light, and you know, let me know if he needs help or anything like that, if he's experiencing any symptoms. And I would assess his IV site and all that fun stuff. So I'm administering this over 3 minutes. So I'm kind of pushing fast for, you know, time's sake. I'm gonna and after this, I am just pushing it. All right, 3 minutes I would have gave that. I'm rushing it a little bit. There's that. Then I would go ahead and I would clean this, and then I would flush it. I would be flushing this, I already cleaned this, for about 3 minutes after giving him his pain medication. And then when I'm giving this, I would, you know, make him repeat patient teaching. And then also I would be assessing how he's tolerating the pain medication. And I would also document all this. I would document the catheter size, the pain medication I used, the date, time, how he tolerated, the fluid I used to flush, the blood return, the response from the patient, all that fun stuff. And I would be doing this for about 3 minutes. I would also document that I assessed the catheter size, and that and then also I provided him the teaching. Okay, I did this for 3 minutes. Okay, I did that for 3 minutes. All right, after this, I would go ahead, clean this off. Throw all this away. I would put the sharps in the sharps container, okay? I would tape this to his arm, and also I labeled all that with my initials, catheter size, and all that fun stuff. I would tape this. He has his call light, his bed is low and locked. I will be documenting everything that I have done. I will remove my gloves, hand hygiene, and